In 1996, the Baby Friendly Hospital Initiative was introduced in Belize. Breastfeeding policy was developed 1996, and then they started with the introduction of the initiative in 1997. However, we were not successful at that time to certify any of our hospitals. In 2006, we reintroduced the Baby Friendly Hospital Initiative. This has proven to contribute to reduce the under 5 mortality rate in countries. It's an initiative that promotes exclusive breastfeeding. We work with the pregnant women during pregnancy, preparing them for the exclusive breastfeeding. And then in hospital, we ensure that they're taught how to breastfeed, and we observe the breastfeeding practice in the hospital. So the main issue that we want to contribute to is the reduction of the under 5 mortality rate in Belize. The data on exclusive breastfeeding, we utilize the data coming out from the MICS, the Multiple Indicator Cluster Survey, which is implemented every 5 years with the support from UNICEF. So in the first mix, we had 10% of women reporting exclusive breastfeeding for the first 6 months. And then in 2011, that percentage went up to 14%. And in 2015, it went up to 33%. So we constantly monitor, but we use the data from the mix because that is all-inclusive, meaning every woman that had a young child that could respond to this question had the same opportunity to participate. So I remove the bias from if we were to use just the administrative data. There is a monitoring tool that is applied. So the assessment to certify a hospital is objective. The assessment is done by external evaluators, meaning it cannot be done by the staff from the same hospital. So what we do is we have staff, let's say from a Northern Regional Hospital, coming to Southern Regional Hospital to do the assessment. And then based on the results, then this is shared with the hospital, and then we proceed to certify the hospital. We certified the first hospital in 2008. So as you can see, the policy was issued 2006. So it took us almost 2 years to get that the first hospital, which was Carl Krishna Memorial Hospital, to get them ready for certification. Thereafter, all the other public sector hospitals followed. We monitor the results, as I mentioned earlier, through the MICS, the Multiple Indicator Cluster Survey, and we can see the trend in the increase of the exclusive breastfeeding rate. Exclusive breastfeeding means that for the first 6 months, the child received only breast milk. We had 10% in 2006. We had 14% of the exclusive breastfeeding rate in 2011 and 33% in 2015. We are waiting on the next mix to see how much more we increase compared to 2015. And the higher percentage represents better outcome for young children.